Question 1. A 26-year-old postpartum client receiving a continuous intravenous magnesium sulfate infusion for severe preeclampsia suddenly becomes increasingly lethargic. The nurse notes that the client's respiratory rate has decreased from 18 breaths/min to 10 breaths/min over the last hour. Deep tendon reflexes are absent bilaterally. Urine output over the last 4 hours is 80 milliliters, and the fetal monitor had previously shown reassuring patterns before delivery. The most recent serum magnesium level is 9.8 milligrams per deciliter. Which nursing action is the priority? A. Increase the rate of the maintenance for fluids. B. Prepare to administer calcium gluconate intravenously. C. Reassess the blood pressure in 30 minutes. D. Place the client in Trendelenburg position. Answer. B. Prepare to administer calcium gluconate intravenously. Rationale. Absent reflexes, respiratory depression, oliguria, and elevated magnesium levels indicate life-threatening magnesium toxicity. Calcium gluconate is the antidote and must be administered immediately while the infusion is stopped and emergency support is initiated. Question 2. A client with severe preeclampsia has been receiving magnesium sulfate at 2G/HR for seizure prophylaxis. During bedside assessment, the nurse identifies a respiratory rate of 11 breaths/min, oxygen saturation of 92%, and diminished patellar reflexes graded at 1+. Urine output for the previous 2 hours totals 20 milliliters. Which finding most strongly indicates worsening magnesium toxicity? A. Oxygen saturation of 92%. B. Urine output of 20 milliliters over 2 hours. C. Patellar reflexes graded at 1+. D. Respiratory rate of 11 breaths/min. Answer. B. Urine output of 20 milliliters over 2 hours. Rationale. Magnesium is excreted through the kidneys. Oliguria causes magnesium accumulation and significantly increases the risk of toxicity progression. This finding predicts worsening toxicity and requires immediate intervention. Question 3. A laboring client receiving magnesium sulfate develops flushing, nausea, and generalized muscle weakness. The nurse notes that deep tendon reflexes are present but sluggish. Respirations are 14 breaths/min, and serum magnesium level is 6.5 milligrams per deciliter. Which interpretation by the nurse is most accurate? A. The client is experiencing therapeutic magnesium effects. B. The client is developing early magnesium toxicity. C. The client is demonstrating signs of hypocalcemia. D. The findings indicate impending eclamptic seizure activity. Answer. B. The client is developing early magnesium toxicity. Rationale. Flushing, nausea, muscle weakness, and sluggish reflexes suggest early magnesium toxicity. Therapeutic levels are typically 4 to 7 mg/dl, but symptoms can appear as levels approach the upper therapeutic range. Question 4. A nurse is caring for a client receiving magnesium sulfate therapy after an eclamptic seizure. Which assessment finding requires immediate intervention? A. Warm flushed skin and mild diaphoresis. B. Respiratory rate of 8 breaths/min. C. Blood pressure of 146/90 mmHg. D. Complaint of blurred vision. Answer. B. Respiratory rate of 8 breaths/min. Rationale. Respiratory depression is the most dangerous sign of magnesium toxicity and may rapidly progress to respiratory arrest. Immediate discontinuation of magnesium and administration of calcium gluconate may be required. Question 5. A client with HELLP syndrome is receiving magnesium sulfate. The nurse notes absent patellar reflexes, decreased bowel sounds, and increasing somnolence. Which pathophysiologic mechanism best explains these findings? A. Magnesium blocks neuromuscular transmission. B. Magnesium increases cerebral vasospasm. C. Magnesium stimulates excessive acetylcholine release. D. Magnesium causes sympathetic nervous system hyperactivity. Answer: A. Magnesium blocks neuromuscular transmission. Rationale: excess magnesium depresses neuromuscular conduction and central nervous system activity, causing absent reflexes, lethargy, respiratory depression, and muscle weakness. Question 6. A nurse caring for a client on magnesium sulfate notes the following findings. Respiratory rate 12 breaths/min, urine output 35 milliliters per hour, patellar reflexes 2+, and serum magnesium level 7 milligrams per deciliter. Which action should the nurse take? A. Continue the infusion as prescribed. B. Stop the infusion immediately. C. Administer calcium gluconate stat. D. Notify the provider of severe toxicity. Answer: A. Continue the infusion as prescribed. Rationale: the client remains within the therapeutic magnesium range and has adequate respirations, urine output, and reflexes. No evidence of toxicity is present. Question 7. A postpartum client receiving magnesium sulfate becomes difficult to arouse. The nurse discovers the infusion pump is delivering 6G/HR instead of the prescribed 2G/HR. Which action should the nurse perform first? A. Notify the healthcare provider. B. Stop the magnesium infusion. C. Obtain a stat serum magnesium level. D. Administer oxygen via nasal cannula. Answer: B. Stop the magnesium infusion. Rationale: the priority is preventing further magnesium administration. Stopping the infusion immediately is the first intervention before additional measures are initiated. Question 8. A nurse is monitoring a client receiving magnesium sulfate for severe preeclampsia. Which finding most clearly differentiates magnesium toxicity from worsening preeclampsia? A. Persistent headache. B. Hyperreflexia with clonus. C. Respiratory depression. D. Severe hypertension. Answer: C. Respiratory depression. Rationale: respiratory depression is strongly associated with magnesium toxicity, whereas hyperreflexia and clonus are more commonly associated with worsening preeclampsia. Question 9. A nurse prepares to administer calcium gluconate to a client experiencing magnesium toxicity. Which statement best explains the purpose of this medication? A. It rapidly lowers serum magnesium through renal excretion. B. It antagonizes the cardiac and respiratory effects of magnesium. C. It reverses cerebral edema associated with eclampsia. D. It prevents hypertensive crisis caused by magnesium withdrawal. Answer: B. It antagonizes the cardiac and respiratory effects of magnesium. Rationale: calcium gluconate directly opposes magnesium's depressant effects on the neuromuscular and cardiovascular systems and is the antidote for toxicity. Question 10. A client on magnesium sulfate therapy develops complete absence of deep tendon reflexes, severe hypotension, and respiratory arrest. Which serum magnesium level would the nurse anticipate? A. 3 milligrams per deciliter. B. 5 milligrams per deciliter. C. 8 milligrams per deciliter. D. Greater than 12 milligrams per deciliter. Answer: D. Greater than 12 milligrams per deciliter. Rationale: severe magnesium toxicity causing respiratory arrest and cardiovascular collapse typically occurs at magnesium levels above 12 milligrams per deciliter. Question 11. A 30-year-old client with severe preeclampsia is receiving magnesium sulfate at 2G/HR. During hourly assessment, the nurse notes a respiratory rate of 9 breaths/min, oxygen saturation of 89%, and absent patellar reflexes. The infusion pump continues running. Which action should the nurse perform immediately after discontinuing the infusion? A. Place the client in high Fowler position and reassess in 15 minutes. B. Administer calcium gluconate as prescribed. C. Obtain a urine specimen for protein analysis. D. Increase the magnesium sulfate infusion to prevent seizure recurrence. Answer: B. Administer calcium gluconate as prescribed. Rationale: The client demonstrates severe magnesium toxicity with respiratory depression and absent reflexes. After stopping the infusion, calcium gluconate should be administered immediately to reverse life-threatening effects. Question 12. A nurse caring for a postpartum client receiving magnesium sulfate understands that which assessment finding is usually the earliest indicator of magnesium toxicity? A. Cardiac arrest. B. Respiratory arrest. C. Loss of deep tendon reflexes. D. Generalized tonic-clonic seizure activity. Answer. C. Loss of deep tendon reflexes. Rationale. Loss or depression of deep tendon reflexes is often the earliest clinical sign of magnesium toxicity and occurs before severe respiratory or cardiac complications. Question 13. A client receiving magnesium sulfate for eclampsia prophylaxis reports feeling extremely weak and complains of double vision. The nurse notes respirations of 13 breaths/min, sluggish reflexes, and a serum magnesium level of 8.4 milligrams per deciliter. Which nursing interpretation is most appropriate? A. The client is within normal therapeutic range. B. The client is developing progressive magnesium toxicity. C. The client is experiencing hypovolemic shock. D. The findings indicate worsening cerebral edema. Answer. B. The client is developing progressive magnesium toxicity. Rationale. Muscle weakness, visual disturbances, sluggish reflexes, and elevated magnesium levels indicate worsening toxicity that requires prompt intervention. Question 14. A nurse is reviewing prescriptions for a client receiving magnesium sulfate therapy. Which additional prescription should the nurse question? A. Strict intake and output monitoring. B. Hourly deep tendon reflex assessment. C. Lactated ringers at 125 milliliters per hour. D. Morphine sulfate for every 2 hours PRN severe pain. Answer. D. Morphine sulfate for every 2 hours PRN severe pain. Rationale. Morphine may potentiate respiratory depression when combined with magnesium sulfate, increasing the risk of severe toxicity and respiratory failure. Question 15. A client receiving magnesium sulfate has a urine output averaging 18 milliliters per hour for the past 3 hours. Which outcome is the nurse most concerned about if this trend continues? A. Hyperactive reflexes. B. Increased magnesium excretion. C. Magnesium accumulation leading to toxicity. D. Development of metabolic alkalosis. Answer. C. Magnesium accumulation leading to toxicity. Rationale. Reduced urine output decreases magnesium elimination, causing accumulation and increased risk of toxic serum magnesium levels. Question 16. A nurse assessing a client on magnesium sulfate notes flushed skin, drowsiness, and diminished reflexes. Which additional finding would indicate the client is progressing from moderate to severe toxicity? A. Nausea. B. Warm extremities. C. Respiratory rate of 7 breaths/min. D. Muscle weakness. Answer. C. Respiratory rate of 7 breaths/min. Rationale. Severe respiratory depression signals progression to life-threatening magnesium toxicity requiring emergency intervention. Question 17. A nurse receives report on 4 clients. Which client should the nurse assess first? A. A client receiving magnesium sulfate with reflexes graded 2+ and urine output of 45 milliliters per hour. B. A client receiving magnesium sulfate reporting facial flushing and nausea. C. A client receiving magnesium sulfate with absent reflexes and respirations of 10 breaths/min. D. A client receiving magnesium sulfate with blood pressure of 150/94 mmHg and mild headache. Answer. C. A client receiving magnesium sulfate with absent reflexes and respirations of 10 breaths/min. Rationale. Absent reflexes and respiratory depression indicate severe magnesium toxicity and place the client at immediate risk for respiratory arrest. Question 18. A postpartum client on magnesium sulfate suddenly develops hypotension, bradycardia, and shallow respirations. Which physiologic effect of magnesium is responsible for these findings? A. Excessive stimulation of the sympathetic nervous system. B. Central nervous system and cardiac conduction depression. C. Increased calcium influx into myocardial cells. D. Peripheral vasoconstriction with reduced tissue perfusion. Answer. B. Central nervous system and cardiac conduction depression. Rationale. High magnesium levels depress neuromuscular activity, cardiac conduction, and respiratory drive, leading to hypotension, bradycardia, and respiratory compromise. Question 19. A nurse is educating a newly licensed nurse about magnesium sulfate administration. Which statement by the newly licensed nurse indicates correct understanding? A. Hyperreflexia is the most dangerous sign of magnesium toxicity. B. Urine output should remain above 30 milliliters per hour during therapy. C. Magnesium sulfate is primarily metabolized by the liver. D. Calcium chloride should be withheld unless seizures occur. Answer. B. Urine output should remain above 30 milliliters per hour during therapy. Rationale. Adequate renal function is essential because magnesium is excreted by the kidneys. Urine output below 30 milliliters per hour significantly increases toxicity risk. Question 20. A client with severe preeclampsia receiving magnesium sulfate develops apnea. The nurse activates the emergency response system. Which intervention should the nurse anticipate next? A. Administration of 4-calcium gluconate. B. Administration of 4-potassium chloride. C. Rapid infusion of hypertonic saline. D. Immediate administration of oxytocin. Answer. A. Administration of 4-calcium gluconate. Rationale. Apnea caused by magnesium toxicity is a medical emergency. Calcium gluconate is the antidote used to reverse respiratory and cardiac depression. Question 21. A 24-year-old client with severe preeclampsia has been receiving magnesium sulfate for 12 hours. During assessment, the nurse notes the client is increasingly confused, difficult to arouse, and speaking with slurred speech. Respirations are 10 breaths/min. Urine output is 22 milliliters per hour, and patellar reflexes are absent. Which action should the nurse implement first? A. Administer prescribed antihypertensive medication. B. Stop the magnesium sulfate infusion immediately. C. Obtain a stat head CT scan. D. Reposition the client onto the right side. Answer. B. Stop the magnesium sulfate infusion immediately. Rationale. The client is demonstrating severe magnesium toxicity. The priority intervention is stopping further magnesium administration before additional emergency measures are taken. Question 22. A nurse caring for a client on magnesium sulfate reviews the latest laboratory results. Which serum magnesium value requires immediate intervention? A. 4.8 milligrams per deciliter. B. 6.2 milligrams per deciliter. C. 7.0 milligrams per deciliter. D. 11.4 milligrams per deciliter. Answer. D. 11.4 milligrams per deciliter. Rationale. Magnesium levels above the therapeutic range significantly increase the risk for respiratory depression, cardiac conduction abnormalities, and cardiac arrest. Question 23. A client receiving magnesium sulfate complains of chest heaviness and increasing shortness of breath. Assessment reveals diminished breath sounds, oxygen saturation of 88%, and absent deep tendon reflexes. Which nursing diagnosis is the priority? A. Risk for ineffective breastfeeding. B. Impaired urinary elimination. C. Ineffective breathing pattern. D. Acute pain related to uterine cramping. Answer. C. Ineffective breathing pattern. Rationale. Respiratory compromise is the most life-threatening complication of magnesium toxicity and takes priority over all other concerns. Question 24. A nurse suspects magnesium toxicity in a postpartum client. Which medication should the nurse ensure is readily available at the bedside? A. Oxytocin. B. Terbutaline. C. Calcium gluconate. D. Naloxone. Answer. C. Calcium gluconate. Rationale. Calcium gluconate is the antidote for magnesium toxicity and must be readily available whenever magnesium sulfate is administered. Question 25. A client receiving magnesium sulfate has the following assessment findings. Respiration 16 breaths/min, urine output 40 milliliters per hour, reflexes 1+, and complaints of flushing and drowsiness. Which interpretation by the nurse is most appropriate? A. The client is experiencing severe magnesium toxicity. B. The client is demonstrating expected magnesium side effects. C. The client is developing pulmonary edema. D. The client is experiencing worsening eclampsia. Answer. B. The client is demonstrating expected magnesium side effects. Rationale. Flushing, mild drowsiness, and slightly diminished reflexes can occur during therapeutic magnesium administration as long as respirations and urine output remain adequate. Question 26. A nurse notes that a client receiving magnesium sulfate has suddenly developed profound muscle weakness and cannot lift her arms against gravity. Which additional finding would most strongly confirm magnesium toxicity? A. Hyperactive bowel sounds. B. Increased urine output. C. Depressed, deep tendon reflexes. D. Severe uterine contractions. Answer. C. Depressed, deep tendon reflexes. Rationale. Magnesium toxicity commonly presents with muscle weakness and depressed or absent deep tendon reflexes due to neuromuscular suppression. Question 27. A client with eclampsia is receiving magnesium sulfate. Which assessment finding indicates the medication is achieving the intended therapeutic effect? A. Respiratory rate of 8 breaths/min. B. Absence of seizure activity. C. Absent patellar reflexes. D. Urine output less than 25 milliliters per hour. Answer. B. Absence of seizure activity. Rationale. Magnesium sulfate is administered primarily to prevent or control seizures in clients with preeclampsia and eclampsia. Question 28. A nurse is caring for a client receiving magnesium sulfate who suddenly develops a weak pulse, hypotension, and prolonged PR interval on cardiac monitoring. Which complication should the nurse suspect? A. Pulmonary embolism. B. Hypovolemic shock. C. Severe magnesium toxicity affecting cardiac conduction. D. Disseminated intravascular coagulation. Answer. C. Severe magnesium toxicity affecting cardiac conduction. Rationale. High magnesium levels depress cardiac conduction and may produce hypotension, bradycardia, conduction delays, and eventual cardiac arrest. Question 29. A nurse assessing a client on magnesium sulfate notes that the client's deep tendon reflexes have changed from 2+ to absent over the last 2 hours. Which additional finding would require the most urgent intervention? A. Blood pressure 150/92 mmHg. B. Respiratory rate 9 breaths/min. C. Complaint of mild nausea. D. Température 99.1 degrés F. 37.3 degrés C. Answer. B. Respiratory rate 9 breaths/min. Rationale. Respiratory depression in combination with absent reflexes strongly indicates severe magnesium toxicity and impending respiratory arrest. Question 30. A postpartum client receiving magnesium sulfate becomes unresponsive. The nurse notes apnea and a thready pulse. After stopping the infusion and calling for help, which intervention should the nurse prioritize? A. Initiate seizure precautions. B. Prepare for ventilatory support. C. Encourage oral hydration. D. Obtain a urine protein specimen. Answer. B. Prepare for ventilatory support. Rationale. Airway and breathing take priority during severe magnesium toxicity. Respiratory support may be life-saving, while calcium gluconate and additional interventions are initiated. Question 31. A 29-year-old client receiving magnesium sulfate for severe preeclampsia begins complaining of extreme fatigue and difficulty taking deep breaths. The nurse notes respirations of 11 breaths/min, oxygen saturation of 90%, and absent biceps and patellar reflexes. Which physician prescription should the nurse implement first? A. Increase the magnesium sulfate infusion rate. B. Administer calcium gluconate 4 push slowly as prescribed. C. Initiate seizure precautions. D. Obtain a repeat blood pressure in 1 hour. Answer. B. Administer calcium gluconate 4 push slowly as prescribed. Rationale. The client is exhibiting classic severe magnesium toxicity with respiratory depression and absent reflexes. Calcium gluconate reverses the toxic neuromuscular and cardiac effects. Question 32. A nurse is assessing a client receiving magnesium sulfate therapy. Which finding best indicates therapeutic effectiveness without evidence of toxicity? A. Respiratory rate of 16 breaths/min with reflexes 2+. B. Respiratory rate of 9 breaths/min with absent reflexes. C. Urine output of 18 milliliters per hour with flushing. D. Oxygen saturation of 88% with lethargy. Answer. A. Respiratory rate of 16 breaths/min with reflexes 2+. Rationale. Normal respirations, intact reflexes, and adequate physiologic function indicate therapeutic magnesium levels without toxicity. Question 33. A client receiving magnesium sulfate develops oliguria secondary to acute kidney injury. Which explanation best describes why this places the client at increased risk for magnesium toxicity? A. Magnesium becomes trapped within skeletal muscle tissue. B. Reduced renal clearance causes magnesium accumulation. C. Magnesium stimulates excessive sodium excretion. D. Oliguria enhances magnesium absorption from the intestine. Answer. B. Reduced renal clearance causes magnesium accumulation. Rationale. Magnesium is excreted primarily through the kidneys. Impaired renal function reduces clearance and allows toxic serum levels to develop. Question 34. A laboring client receiving magnesium sulfate suddenly becomes difficult to awaken. The nurse notes a respiratory rate of 7 breaths/min and oxygen saturation of 84%. Which nursing intervention takes highest priority? A. Apply oxygen and support ventilation. B. Assess the fetal heart rate tracing. C. Administer prescribed antihypertensive medication. D. Encourage coughing and deep breathing exercises. Answer. A. Apply oxygen and support ventilation. Rationale. Airway and breathing are the priority during severe magnesium toxicity. Respiratory support must be initiated immediately to prevent respiratory arrest. Question 35. A nurse reviewing laboratory results for a client receiving magnesium sulfate identifies a serum magnesium level of 5.8 milligrams per deciliter. Which nursing interpretation is most accurate? A. The client is experiencing severe toxicity. B. The magnesium level is subtherapeutic. C. The magnesium level is within therapeutic range. D. The client is approaching cardiac arrest. Answer. C. The magnesium level is within therapeutic range. Rationale. Therapeutic magnesium levels for seizure prophylaxis generally range from 4 to 7 mg/dl. Question 36. A nurse is educating a pregnant client about magnesium sulfate therapy. Which client's statement indicates correct understanding regarding toxicity symptoms? A. If my reflexes become difficult to elicit, I should report it immediately. B. Rapid breathing is the most dangerous sign of toxicity. C. Increased urine output means magnesium is accumulating. D. Severe toxicity usually causes hyperactive reflexes. Answer. A. If my reflexes become difficult to elicit, I should report it immediately. Rationale: diminished or absent reflexes are early indicators of magnesium toxicity and should be reported promptly. Question 37. A client receiving magnesium sulfate develops severe hypotension and bradycardia. Which serum magnesium level would the nurse most likely expect? A. 3 mg per deciliter. B. 5 mg per deciliter. C. 7 mg per deciliter. D. 13 mg per deciliter. Answer: D. 13 mg per deciliter. Rationale: severe cardiovascular depression, including hypotension and bradycardia, typically occurs at very high magnesium levels above 12 mg per deciliter. Question 38. A postpartum client on magnesium sulfate is noted to have shallow respirations and increasing carbon dioxide retention on arterial blood gas analysis. Which acid-base imbalance should the nurse anticipate? A. Metabolic acidosis. B. Respiratory acidosis. C. Respiratory alkalosis. D. Metabolique alkalosie. Answer: B. Respiratory acidosis. Rationale: respiratory depression causes hypoventilation and carbon dioxide retention, resulting in respiratory acidosis. Question 39. A nurse caring for a client on magnesium sulfate identifies absent deep tendon reflexes. Which action should the nurse take next? A. Continue the infusion and reassess in 1 hour. B. Stop the infusion and further assess respiratory status. C. Encourage increased oral fluid intake. D. Place the client in Trendelenburg position. Answer: B. Stop the infusion and further assess respiratory status. Rationale: absent reflexes indicate potential toxicity. The infusion should be stopped immediately while respiratory and cardiovascular status are evaluated. Question 40. A nurse preparing to administer magnesium sulfate understands that which equipment is most essential to have readily available at the bedside? A. Chest tube insertion tray. B. Defibrillator pads only. C. Calcium gluconate and resuscitation equipment. D. External fetal scalp electrode kit. Answer: C. Calcium gluconate and resuscitation equipment. Rationale: because magnesium toxicity can rapidly progress to respiratory arrest and cardiac complications, emergency antidote medication and resuscitation equipment must always be accessible. Question 41. A client receiving magnesium sulfate for severe preeclampsia suddenly reports inability to move her legs effectively and states, "I feel like I can't breathe deeply." Assessment reveals respirations of 8 breaths/min, oxygen saturation of 86%, and absent patellar reflexes. Which intervention should the nurse implement first? A. Obtain a stat serum magnesium level. B. Administer prescribed hydralazine. C. Support airway and ventilation. D. Reposition the client onto the left side. Answer: C. Support airway and ventilation. Rationale: airway and breathing are the immediate priorities in severe magnesium toxicity. Respiratory depression can rapidly progress to respiratory arrest. Question 42. A nurse monitoring a client on magnesium sulfate notes the following findings: urine output 24 milliliters per hour, respiratory rate 13 breaths/min, and diminished reflexes. Which complication is the client most at risk for? A. Magnesium toxicity. B. Septic shock. C. Pulmonary embolism. D. Disseminated intravascular coagulation. Answer: A. Magnesium toxicity. Rationale: low urine output reduces magnesium excretion, significantly increasing the risk for toxic magnesium accumulation. Question 43. A client receiving magnesium sulfate therapy begins experiencing severe respiratory depression. Which additional assessment finding would the nurse most likely observe? A. Hyperactive deep tendon reflexes. B. Severe muscle rigidity. C. Absent deep tendon reflexes. D. Persiste tachycardia. Answer: C. Absent deep tendon reflexes. Rationale: respiratory depression and absent reflexes commonly occur together in advanced magnesium toxicity due to neuromuscular suppression. Question 44. A nurse is caring for a postpartum client receiving magnesium sulfate who suddenly develops cardiac conduction abnormalities on telemetry monitoring. Which finding would the nurse anticipate first? A. Shortened PR interval. B. Ventricular hypertrophy. C. Prolonged PR interval and bradycardia. D. Supraventricular tachycardia. Answer: C. Prolonged PR interval and bradycardia. Rationale: magnesium toxicity depresses cardiac conduction, often producing bradycardia and prolonged conduction intervals before cardiac arrest develops. Question 45. A nurse caring for a client receiving magnesium sulfate understands that which finding indicates the need to withhold the next dose and notify the healthcare provider? A. Respiratory rate of 17 breaths/min. B. Patellar reflexes graded 2+. C. Urine output of 15 milliliters per hour. D. Mild facial flushing. Answer: C. Urine output of 15 milliliters per hour. Rationale: urine output below 30 milliliters per hour suggests impaired magnesium clearance and greatly increases toxicity risk. Question 46. A client with severe preeclampsia receiving magnesium sulfate suddenly becomes apneic. After stopping the infusion, which medication should the nurse anticipate administering? A. Naloxone. B. Calcium gluconate. C. Epinephrine. D. Sodium bicarbonate. Answer: B. Calcium gluconate. Rationale: calcium gluconate is the antidote used to reverse severe magnesium toxicity causing respiratory or cardiac compromise. Question 47. A nurse assessing a client on magnesium sulfate identifies lethargy, slurred speech, and progressive muscle weakness. Which laboratory value would most strongly support magnesium toxicity? A. Serum magnesium 2 mg per deciliter. B. Serum magnesium 4 mg per deciliter. C. Serum magnesium 6 mg per deciliter. D. Serum magnesium 11 mg per deciliter. Answer: D. Serum magnesium 11 mg per deciliter. Rationale: neurologic depression and severe weakness are associated with toxic magnesium levels significantly above the therapeutic range. Question 48. A postpartum client receiving magnesium sulfate develops respiratory arrest. Which nursing action is the highest priority after calling for help? A. Begin ventilatory support with oxygen. B. Check the client's temperature. C. Insert an indwelling urinary catheter. D. Reassess deep tendon reflexes. Answer: A. Begin ventilatory support with oxygen. Rationale: respiratory arrest requires immediate airway and breathing support to maintain oxygenation while emergency treatment is initiated. Question 49. A nurse is evaluating a newly licensed nurse caring for a client on magnesium sulfate. Which action by the newly licensed nurse requires immediate correction? A. Assessing deep tendon reflexes hourly. B. Monitoring urine output every hour. C. Administering magnesium despite respirations of 9 breaths/min. D. Keeping calcium gluconate available at the bedside. Answer: C. Administering magnesium despite respirations of 9 breaths/min. Rationale: respirations below 12 breaths/min indicate possible magnesium toxicity. The medication should be withheld and the provider notified immediately. Question 50. A client receiving magnesium sulfate for seizure prophylaxis demonstrates absent reflexes, severe hypotension, respiratory depression, and electrocardiographic changes. Which complication should the nurse recognize as imminent if treatment is delayed? A. Acute renal failure. B. Status epilepticus. C. Cardiac arrest. D. Hypertensive crisis. Answer: C. Cardiac arrest. Rationale: untreated severe magnesium toxicity can progress from neuromuscular and respiratory depression to complete cardiovascular collapse and cardiac arrest.
Thanks for watching 50 of the most dangerous magnesium toxicity, the most failed Nclex sign. If this video helped sharpen your Nclex critical thinking, make sure you like the video, subscribe to MCQs Master 101, turn on the notification bell, share this with another nursing student. Remember, absent deep tendon reflexes, respiratory depression, and bradycardia are major red flags for magnesium toxicity, and Nclex loves testing them. Drop your score or toughest question in the comments below. See you in the next Nclex Mastery session.